Hi, I'm Renee Van Staveren. I work with hundreds of agents across the country, and I lead Medicare education at Connie Health. In this beginner's video, we'll review what is Medicare Part C. We'll also go over why you might want a plan like this, plus its coverage, costs, and how to enroll. So let's jump right into it. What is a Medicare Part C plan? Medicare Part C plans are often called Medicare Advantage plans. For short, you might hear them called Part C or MA. MA simply stands for Medicare Advantage. Medicare Part C plans are your all-in-one or a bundled alternative to original Medicare. Medicare Part C plans are offered by private insurance companies, but you can rest assured because they're also regulated by the Centers for Medicare and Medicaid Services, or CMS. With Medicare Part C, you get equal benefits and coverage to original Medicare, plus extra benefits. Part C bundled plans include Medicare Part A hospital coverage, plus Medicare Part B medical coverage, and most plans include Medicare Part D prescription drug coverage. Now you may be asking yourself, well, how are you eligible for a Medicare Part C plan? Anyone who is enrolled in a Medicare Part A and Medicare Part B plan is eligible to enroll in a Medicare Part C plan. Now, why might you need a Medicare Part C plan? Medicare Part C or Medicare Advantage plans are beneficial for many reasons, but I'll share two. This is my top reason. Number one is that Medicare Part C plans have an out-of-pocket maximum. Original Medicare does not. That means that 20% coinsurance that you may be paying or your copayments, they are unlimited. You could be paying and paying and paying, and you're really putting yourself in financial risk. Should you have a serious injury or illness occur, you could be paying a lot out of pocket with original Medicare alone. Medicare Part C provides an out-of-pocket maximum, so you know how much annually you may be liable. This can provide a lot of peace of mind and help you prevent financial hardship or medical debt. The second reason you may want a Medicare Part C or Medicare Advantage plan is because they offer benefits that original Medicare doesn't. These benefits may include routine dental, vision, and hearing. Most Medicare Part C or Medicare Advantage plans offer these benefits and more, so you can continue your routine services at a reasonable cost. Because original Medicare doesn't offer a maximum out-of-pocket, we recommend that everyone on Medicare have supplemental coverage. Medicare Part C, or also known as Medicare Advantage plans, or Medicare supplement plans are two ways that you can get full coverage on Medicare. If you'd like more information on Medicare supplement plans, I've linked that video in the description below. Now, what does Medicare Part C cover? In short, Medicare Part C provides equal coverage to Medicare Part A hospital coverage and Medicare Part B medical coverage, plus more. If you're not sure about what Medicare Part A and B covers, I've linked helpful videos and articles in the description below. The coverage that really sets Medicare Part C apart is the routine coverage that I mentioned, the dental, the vision, the hearing. If you're worried about your dental exams, or if you need a root canal or dentures, or if you need vision or glasses, hearing aids, you should really look into a Medicare Advantage plan because the majority of plans provide these types of benefits. If there's a specific type of coverage that you're looking for and original Medicare doesn't cover it, you should let one of our local licensed agents know. A Connie Health agent can help you find the benefits and coverage that you need at a cost that you can afford. I truly hope that you're finding this video to be valuable. If you are, take a moment and hit the like button below and watch this video till the end, where I'll share more helpful links to support you on your Medicare journey. Now, let's get back to the video. Now, let's discuss how Medicare Part C and Medicare prescription drug coverage may work together. In most cases, a Medicare Part C plan also offers Medicare Part D prescription drug coverage, and it's in a bundled way. Many of these plans are called Medicare Advantage prescription drug plans because they're together. There are a couple plans that don't offer this kind of bundled service with prescription drug coverage, and those are called Medicare savings plans or cost plans. In the case of Medicare savings or cost plans, you would need to buy a separate Medicare Part D prescription drug plan. Now, the best time to enroll in your prescription drug plan is during your initial enrollment period. That is a 7-month enrollment period that starts 3 months before you turn 65, includes the month of your 65th birthday, and the 3 months after the month of your 65th birthday, 7 months. If you don't enroll in prescription drug coverage during that time, you may face a late enrollment penalty if you do not have credible coverage from another source. Now, a couple tips. Most Medicare Advantage prescription drug plans or Medicare Part D prescription drug plans have a formulary. If you're currently on prescription medications, this formulary is kind of a tiered system. There are lower tier, medium tier, higher and higher tiers. The lower tiers are generally the more generic medications that will cost you less. If you're currently on medication, to minimize your costs, look for medications that are in lower tiers, because then you'll get a more favorable cost. Also, the pharmacy in which you get your medications can also impact the cost. Insurance companies divide up pharmacies between a preferred or a standard tier. And generally, preferred pharmacies have lower costs. So if you're looking for ways to minimize your costs, let a local licensed Connie Health agent know. Let them know that you're looking for generic medications at preferred pharmacies. Now, how much does Medicare Part C cost? First, let's discuss Medicare Part C plan premiums. Medicare Part C plan premiums start at $0 per month. Now, this depends on the benefits and your location. If you do enroll in a Medicare Advantage plan with a $0 monthly premium, don't forget you still have the Medicare Part B premium to pay. You want to make sure you factor that into your monthly budget. If you're curious about this year's Medicare Part B premium, I've linked an article in the description below. One way to learn how much a Medicare Part C or Medicare Advantage plan might cost you is to speak with a Connie Health agent in your area. A Connie Health agent can review plans in your area and provide various options based on your healthcare and budget needs. Now, let's discuss the deductible, coinsurance, and out-of-pocket maximum. Some Medicare Part C plans have a deductible. Now, this is the amount of money that you would need to pay before any medical or prescription drug costs are covered by the insurance company. Many Part C plans don't have a deductible, and if this is something that's important to you, let your local licensed Connie Health agent know. They can help you find a plan that suits your budget. Your Medicare plan may also have coinsurance or copayments. These are the amounts due at the time of service. There are Medicare Part C plans that don't have coinsurance or copays, and if this is something important to you, you should let your Connie Health agent know. Out-of-pocket maximum. This is the maximum amount of money that you would pay in any given year. It's important to note that some costs don't count towards your out-of-pocket maximum, and these include your premium, prescription drug costs, services not covered by the plan, and some charges from out-of-network providers. Once you reach your out-of-pocket maximum, your insurance company pays for everything else for the remainder of your plan year. The Centers for Medicare and Medicaid Services, or CMS, sets the Medicare Part C maximum out-of-pocket threshold annually. While there is a maximum threshold set by CMS, individual plans can provide lower out-of-pocket maximums. If you have a certain amount of money in mind in terms of what you would be comfortable with for your out-of-pocket maximum, that's something that you should definitely share with your local licensed agent. They can review plan options to find one that fits your budget. Now, how do you enroll in Medicare Part C? If you're enrolling in Medicare for the first time and it's not a plan change, the best time to enroll is during your initial enrollment period. That's the 7-month window around your 65th birthday, the 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. If you miss your initial enrollment period, the next best opportunity to enroll for the first time is the general enrollment period. This happens every year between January 1st and March 31st. Keep in mind that if you've missed your initial enrollment period and you're enrolling in Medicare for the first time during the general enrollment period, you may face Medicare Part A, B, and D late enrollment penalties. Now, if at some point you enroll in a Medicare Part C plan and it's not really suiting your needs, there are times that you can make a plan change. Okay, get out your pen and paper. If you plan on being enrolled in Medicare Part C plan, you want to mark this on your calendar. The best time to make a Medicare Advantage plan change is during the annual enrollment period. It can also be referred to as AEP. As a general rule, the annual enrollment period, which goes from October 15th to December 7th every year, is a great time to just sit down with your agent and review your plan. Plans change every year. Your prescription drug coverage could change, doctors could leave network, your needs could change in terms of your health or budget. So as a rule of thumb, we really recommend that if you're enrolled in Medicare, you mark this time frame on your calendar and make it a priority to spend a little bit of time with your agent and review your plan to make sure it's still the best one for you. The other opportunity to make a Medicare Advantage plan change is during the Medicare Advantage open enrollment period, and it's between January 1st and March 31st every year. This enrollment period is helpful because you could make a plan change during the annual enrollment period between October 15th and December 7th, have a little bit of time to use your plan, and then discover between January 1st and March 31st whether or not it's the right plan for you. And if it's not, you still have the opportunity to make a plan change. I love this great flexibility. I love that you can review your plan annually, you can adjust it to your needs, and then if it's still not working out for you, you can make another plan change. Between the annual enrollment period and the Medicare Advantage open enrollment period, you have about 5 months to make plan changes. If there is a time outside that period where you need to make a change, you could also make one during a special enrollment period. A Medicare Advantage plan is a great alternative to Original Medicare with its own set of benefits. When reviewing Medicare Part C plans with an agent, we really recommend that you find one tailored to your needs, to your prescription drugs, to the doctors and hospital networks that you want to maintain relationships with, and something that is definitely within your budget. Also, if there are certain benefits or procedures that might be coming up, you can let your agent know and they can find a plan that has those benefits. Meeting with your Connie Health agent and having all of this information in hand will really help you find the plan that is right for you. Now, if you're not already enrolled in Medicare Part B, you should watch the video linked below and learn more about Medicare Part B. If you'd like more information about enrolling in Medicare Part B or discussing your Medicare Part C plan options, call and speak with a local licensed Connie Health agent. A local agent can help you review plan options so you can avoid high out-of-pocket costs and receive the benefits you want and need. Connie Health wrote an article about Medicare Part C's coverage, costs, and how to enroll, making enrollment easy. To read about Medicare Part C, visit the link in the description below. In this video, we discussed what is a Medicare Part C, why you might want a Medicare Part C plan, plus coverage, costs, and how to enroll. If you like this video, hit the like button. And if you want more videos like this, subscribe to our channel. For more Medicare videos for beginners, see the video links in the description below. Until next time.